I stared at the bank of television cameras, my hands trembling as I adjusted the microphone. Behind me sat 3 senators, and in front of me, a room packed with reporters whose cameras would broadcast this moment to millions. My phone buzzed with a text from my sister. "Is that really you on CNN?" The same sister who'd uninvited me from Christmas dinner just 6 months earlier, because my scrubs and tired eyes apparently ruined the family photos. If only she knew that the notebook I'd been clutching that terrible December night, the one filled with Mom's forgotten words and missing memories, was about to change everything. My name is Emily Harris, and at 32 years old, I thought I had life figured out. Well, sort of. I was a registered nurse at Metropolitan General Hospital, pulling double shifts that would make a college student weep. 16-hour days were my normal. Coffee was my religion. And my scrubs? They were practically glued to my body. But here's the thing about being a nurse that nobody tells you. Society calls you a hero until you show up to family dinner looking like you've wrestled with death itself. Which, let's be honest, some days I literally had. December 23rd changed everything for me. I'd just finished the shift from hell. 3 cardiac arrests, 2 violent patients, and 1 particularly memorable incident involving a man who insisted his IV pole was his dance partner. My feet screamed inside my worn sneakers as I drove to my family's Christmas Eve gathering. The GPS estimated 23 minutes, but I spent those 23 minutes rehearsing apologies for my appearance. Rebecca's house always made me feel small. Not physically small, emotionally small. The kind of small you feel when your sister's foyer costs more than your annual salary. She's a real estate agent who could sell ice to penguins and designer handbags to monks. Success dripped from every surface of her home like expensive perfume. I knocked on the door, clutching my homemade gifts. Mason jars filled with my grandmother's jam recipe, and hand-knitted scarves that took me months to finish between shifts. The door opened, and there stood Rebecca in a dress that probably cost more than my car payment. "Emily, you made it." Her smile faltered slightly as she took in my appearance. "Oh, you're still in your work clothes." The gathering was exactly what I'd expected. My brother Michael, the corporate lawyer, discussed his latest case while adjusting his Rolex. His wife showed off photos from their Bahamas vacation. Rebecca's husband talked about their kitchen renovation. Apparently, marble countertops were a life-changing investment. Then there was me, sitting in the corner like a wilted flower, trying not to fall asleep in my chair. "So, Emily," Michael said during dinner, "still enjoying the whole nursing thing?" The whole nursing thing. As if I collected stamps or played weekend tennis. "It's rewarding," I replied, though my voice sounded tired even to me. "I just don't understand why you chose such a thankless profession," he continued. "The hours are terrible. The pay is mediocre. And let's face it, it's basically just following doctor's orders, right?" My father nodded in agreement. "Anyone can learn to take temperatures and hand out pills." The conversation moved on, but something else had caught my attention. Mom, she'd asked me 3 times when I was working next, despite my answering clearly each time. She'd put salt in her coffee instead of sugar and didn't seem to notice. During dessert, she suddenly asked where Aunt Margaret was, even though Margaret had died 5 years ago. Everyone else explained it away. "Mom's getting older. She's tired. The holidays are overwhelming." But I knew better. My medical training was screaming alarm bells that my family couldn't hear. The breaking point came when Rebecca pulled me aside after dinner. Her perfectly manicured nails drummed against her wine glass as she delivered news that would haunt me for months. "Emily, we've been talking, and we think it's best if you skip tomorrow's celebration at the country club." My stomach dropped. "What do you mean? You're always so exhausted. Your stories about work are depressing. And honestly, your financial situation makes everyone uncomfortable. It's Christmas. We want to keep things light and positive." I left that night with my homemade gifts still sitting unopened on Rebecca's entry table. In my car, I started a voice memo on my phone, documenting everything I'd observed about Mom's behavior. That recording would eventually change everything. That voice memo became my obsession. Every spare moment between shifts, I found myself researching dementia symptoms, early intervention protocols, and cognitive decline patterns. My tiny apartment transformed into a makeshift command center. Medical journals stacked on every surface, sticky notes covering my bathroom mirror with Mom's behavioral patterns, and a growing digital folder labeled evidence. The weird part? My family thought I was being dramatic. During my brief visits to check on Mom, I documented everything. The way she forgot my middle name, something she'd never done in 32 years. How she put her keys in the refrigerator and spent 20 minutes searching for them. The confusion when she couldn't remember which remote controlled the television. "You're looking for problems that aren't there," Rebecca told me when I tried explaining my concerns. "Mom's fine. She's just getting older." But I knew the difference between normal aging and cognitive decline. At the hospital, I saw it daily. Families arriving with loved ones whose dementia had progressed far beyond the point where early intervention could help. The guilt in their eyes haunted me. They'd missed the signs, dismissed the symptoms, waited too long. My mother was heading down that same path, and I was the only one who could see it. Then something unexpected happened at work. During one particularly brutal shift, I found myself really observing my colleagues for the first time. Sarah, a veteran nurse with 15 years of experience, had made 3 medication errors in 1 week. Tom, usually sharp as a tack, missed obvious signs of infection in a patient. Maria fell asleep standing up during rounds. We weren't just tired. We were dangerous. The realization hit me like a freight train. How many early dementia cases were we missing because we were too exhausted to think clearly? How many families were going through exactly what mine was experiencing, watching their loved ones decline while medical professionals, burned out and overworked, failed to catch the warning signs? I started attending medical conferences on my days off. Sounds fun, right? Spending your free time listening to geriatricians discuss cognitive assessment tools and neurological biomarkers. My friends thought I'd lost my mind, but something was driving me forward, a connection I couldn't quite name yet. At one conference, Dr. Martinez, a leading dementia researcher, presented statistics that made my blood run cold. Early intervention could slow cognitive decline by up to 40%. 40%. Yet most patients weren't diagnosed until they'd already lost significant brain function, primarily because healthcare workers were too overwhelmed to conduct proper screenings and families dismissed early symptoms as normal aging. The personal became professional in that moment. I started writing. Not medical charts or patient notes, something different. A blog where I could anonymously share what I was learning, what I was observing, what I was living. I called it The Nurse's Notebook and expected maybe my mom to read it, if she remembered. The first post was simple. What happens when the people trained to spot medical problems are too exhausted to see them clearly? I wrote about healthcare worker burnout, about families in denial, about the intersection of personal and professional blindness when it came to recognizing dementia. Then I wrote about Mom. Without using names, I documented her symptoms, the family's dismissal, my growing frustration. I explained how my medical training allowed me to see what others missed, but how my emotional investment made it nearly impossible to act. Something magical happened. The blog exploded. Comments poured in from healthcare workers sharing similar stories. Adult children recognizing their own parents' symptoms. Families grateful for the early warning signs I'd outlined. Medical professionals admitting their own cases of burnout-induced missed diagnoses. But my family remained oblivious. Not just to the blog. They had no idea it existed, but to Mom's continued decline and my growing expertise in elder care advocacy. Easter dinner was particularly brutal. Mom asked the same question 7 times. When is Emily coming? I was sitting right next to her. Mom's having an off day, Michael explained to his wife, as if cognitive decline was like a bad hair day. Meanwhile, I was secretly networking with advocacy groups, attending policy meetings, and researching healthcare reform initiatives. My blog had caught the attention of several elder care organizations who invited me to contribute articles and speak at local events. Leading a double life is exhausting. By day, I was the family disappointment, the tired nurse who couldn't afford nice clothes or fancy vacations. By night, I was becoming a voice in the healthcare reform movement, writing policy recommendations and consulting with medical professionals about early dementia detection protocols. The irony wasn't lost on me. My family dismissed my medical expertise while I was quietly becoming an expert in the exact condition affecting our mother. My research deepened. I learned about the financial barriers preventing working families from accessing proper elder care. The way insurance companies avoided covering early cognitive assessments. How social stigma around dementia kept families in denial long past the point where intervention could help. Every revelation felt personal. Every statistic represented not just numbers, but families like mine. Successful on the surface, struggling beneath, missing opportunities to help the people they loved most. The blog's readership continued growing. Healthcare workers shared it in private Facebook groups. Adult children forwarded posts to siblings. Medical professionals began citing my articles in their own research. Yet I remained invisible to my own family. The excluded sister, the unsuccessful daughter, the nurse who just followed doctor's orders. The breaking point came in late spring when Mom had what Michael called a small episode at the grocery store. She'd forgotten how to write a check, became confused about where she was, and had to call Rebecca for help. Maybe we should have her evaluated, I suggested during the family phone call that followed. Evaluated for what? Rebecca's voice carried that familiar, dismissive tone. She was just overwhelmed. The grocery store was crowded. Rebecca, these aren't isolated incidents. I've been documenting? Emily, you're not a doctor. You're a nurse. There's a difference. That night, I received an email that would change everything. A Senate subcommittee on healthcare worker burnout and eldercare had discovered my blog. They wanted me to testify. The subject line read, Congressional Testimony Invitation, Healthcare Reform. I stared at my laptop screen, knowing that accepting this invitation would expose everything. My family's situation, Mom's condition, my secret life as an advocate. But I also knew it was the opportunity I'd been unconsciously preparing for since that terrible Christmas Eve 6 months earlier. The notebook I'd been filling with Mom's forgotten words and missing memories was about to become evidence in a case for nationwide healthcare reform. I clicked reply and typed 3 words. I'll be there. What I didn't expect was how that decision would transform not just healthcare policy, but my entire relationship with the family who'd dismissed me for so long. I never expected my voice to shake when I spoke into that microphone, but there I was, surrounded by senators and cameras, about to expose my family's biggest secret on national television. The prepared statement in my hands felt like it weighed 1,000 pounds. My mother has dementia, I began, hearing my words echo through the chamber. For 18 months, I've documented her cognitive decline while my family dismissed my concerns as dramatic overreach from their unsuccessful nurse daughter. The room went completely silent. Well, except for the aggressive clicking of camera shutters. I pulled out the notebook that had started everything. The same one I'd clutched during that awful Christmas Eve. This contains detailed observations of my mother's symptoms, research on early intervention protocols, and documentation of how healthcare worker burnout contributes to missed diagnoses in families just like mine. Senator Williams leaned forward. Ms. Harris, can you explain how your personal experience connects to the broader healthcare crisis? That's when everything poured out. The exhausted nurses missing obvious signs, the families too proud or scared to seek help, the insurance companies avoiding early cognitive screenings because they're expensive. My mother putting salt in her coffee while my successful siblings explained it away as just getting older. When healthcare workers are pulling 16-hour shifts and running on 3 hours of sleep, we miss things, I explained. But when families dismiss medical expertise because it comes from someone who can't afford designer clothes, we create a perfect storm of neglect. The irony tasted bitter in my mouth. My family excluded me from Christmas dinner because my profession embarrassed them. Meanwhile, I was quietly becoming a leading voice in elder care reform, trying to save my mother and thousands like her. Then came the questions that made my testimony go viral. Senator Martinez asked about policy solutions. I rattled off statistics about early intervention success rates, funding mechanisms for cognitive screening programs, and support systems for healthcare workers. 18 months of secret research flowed out of me like water breaking through a dam. The hearing ended, but my phone immediately exploded. Text after text from family members who'd watched the broadcast in shock. Rebecca's message was typical. "Why didn't you tell us you were doing all this?" Michael called within minutes. "Emily, I had no idea you were involved in policy work. This is incredible." Incredible. The same word he'd never used to describe my nursing career. But the real transformation happened over the following weeks. News outlets picked up my story. The narrative was perfect for television. Hard-working nurse whose own family dismissed her expertise while she advocated for their mother's care. CNN, NBC, Fox News. Everyone wanted to interview the nurse who'd become an accidental healthcare reform leader. My blog readership exploded from hundreds to thousands to hundreds of thousands. Speaking invitations poured in from medical conferences, policy organizations, and advocacy groups. The American Nurses Association asked me to lead their new initiative on healthcare worker burnout and patient safety. Then came the call that changed everything permanently. The Department of Health and Human Services offered me a position as senior advisor on elder care policy. Government salary, federal benefits, and the kind of professional recognition I'd never imagined possible. Dad called me personally for the first time in years. "Emily, I owe you an apology. We completely underestimated what you were capable of." Mom started receiving proper treatment based on my early documentation. Her neurologist said my detailed observations provided invaluable baseline data that would help slow her cognitive decline significantly. The family dinners look different now. They ask about my work with genuine interest. Rebecca introduces me as my sister, the healthcare policy expert. Michael seeks my advice on legal cases involving medical malpractice. But you want to know the strangest part? Sometimes I miss being underestimated. There's something powerful about working in the shadows, building expertise while everyone assumes you're just getting by. My phone buzzed with another interview request from 60 Minutes. The subject line read, "Healthcare Hero Follow-Up Story, Healthcare Hero." 6 months ago, I was too embarrassing for family photos. I signed my first national healthcare policy initiative 3 months after that testimony. The Early Cognitive Screening Act, they called it. Funny how a piece of legislation can carry your mother's forgotten coffee conversations and your family's years of dismissal. Mom's treatment started immediately. The neurologist called my documentation remarkably thorough for a family member. I didn't mention the 18 months of secret research. Some ironies are too perfect to explain. Rebecca invited me to Easter dinner. Not the backup plan invitation. The actual dinner. She even asked if I wanted to bring anyone special, which made me laugh because I'd been dating Dr. Martinez from those conferences for 2 months. Turns out shared passion for healthcare reform makes excellent relationship material. "We want to apologize," Dad said during that Easter meal. "Properly." Michael nodded. "We completely missed who you were becoming." Here's what they didn't understand. I wasn't becoming someone new. I was finally being seen for who I'd always been. The Department of Health and Human Services office came with a window view and business cards that read Senior Advisor. My first staff meeting included 12 doctors, 3 policy experts, and me. The nurse who used to fall asleep in hospital break rooms now had people taking notes when I spoke. Mom still forgets things. Early intervention helps, but dementia doesn't disappear because your daughter becomes famous. The difference is now she gets proper care instead of family explanations about normal aging. Last week, a nurse from Ohio sent me her own documentation about her father's symptoms. Her family was dismissing her concerns. "They think I'm just a nurse," she wrote. Just a nurse. Those 3 words used to sting. Now they make me smile. The 60 Minutes interview aired on a Sunday. Rebecca texted during the broadcast. "Mom's watching. She remembers you're important now." Important? Not because I changed, but because everyone else finally noticed what was always there. My phone keeps buzzing with interview requests, policy meetings, speaking engagements. The Christmas dinner I was excluded from feels like ancient history, though it's only been 10 months. Sometimes I pull out that old notebook, the one filled with Mom's forgotten words. Every page represents a moment when my family thought I wasn't good enough to understand what was happening. Those same pages became the foundation for legislation affecting millions of families. The excluded daughter became the expert they should have listened to all along. Turns out being underestimated was just preparation for being undeniable.